is the first wealth, as Ralph Waldo Emerson said, then these are our best investors, making sure that we are healthy today in the Commonwealth and that our communities are healthy tomorrow. These dedicated professionals are at the front lines in Massachusetts of protecting our families, our neighborhoods, and our entire nation. Dr. Rochelle Walensky, the former director of the Centers for Disease Control and Prevention. We thank her for her leadership, the countless lives that were saved during the pandemic because of her leadership. This week she joined with 8 of her former colleagues and heads of the CDC to call out the danger of Robert Kennedy Jr. that he poses as the Secretary of Health and Human Services. By raising the alarm, she is doing what we all must do right now, to stand up and to be brave, to speak the truth and to defend the health of our people and of our democracy. We are also joined by fellow frontline defenders, Dave Foley, the president of SEIU 509, Dr. Mary Beth Mioto, pediatrician at the Mattapan Community Health Center, Dr. Eli Fryman, pediatric emergency medicine physician at Newton Wellesley Hospital, Sarah Beswell, a registered nurse and member of the Massachusetts Nurse Association's Board of Directors, Dr. Christopher Locher, CEO and co-founder of Versatope Therapeutics, and Dr. Hannah Grunwald, postdoctoral fellow at Harvard Medical School. Our nation's public health is at risk because of the reckless and dangerous actions of President Trump and Secretary Robert Kennedy Jr. This has never been clearer amid the chaos at the Centers for Disease Control and Prevention than when Secretary Kennedy forced out CDC Director Susan Monarez and other top CDC officials because they would not rubber stamp his anti-vaccine, anti-science recommendation. So he fired Dr. Monarez. During his Senate confirmation hearings last January, I called Secretary Kennedy unqualified, dangerous, and unfit. And I told him he was disqualified from holding any position in healthcare in our country. I said that as the ranking Democrat, the top Democrat on the Health Subcommittee of the United States Senate. That was in January. Unfortunately, Republicans ignored his obvious anti-science, anti-health beliefs, and in fealty to Donald Trump, they confirmed him anyway. Our worst fears were exemplified yesterday as Secretary Kennedy testified in front of the Senate Finance Committee. Kennedy did not know how many Americans died from COVID-19. The answer is 1.2 million Americans died. Kennedy said he didn't trust the data that showed vaccines were safe and saved lives. He lied to Senator Warren when he said, quote, anybody can get the new COVID booster, even though his FDA just restricted who is able to get the new vaccines. He lied and said there were no cuts to Medicaid in Trump's big, ugly bill, which the Republicans supported and passed. So it's lie after lie after lie from Robert F. Kennedy Jr. The only truth we came away with is how dangerous Robert F. Kennedy Jr. is to the health of our nation and our communities. This isn't a man who is guided by the Hippocratic Oath. He is guided by hypocrisy. And he always has been when it comes to vaccines. He made money off of vaccine denial. He made money off of spreading disinformation. And now he is appointing his own former cronies to positions at the CDC that will only further spread that misinformation about vaccines. Vaccines are not debatable. They are dependable. In 1900, in the United States, 18% of all children died before the age of 5. Life expectancy in the United States in 1900 was 48 years of age. What changed? Vaccines changed. All the other public health interventions that we built into our system changed. We've added 30 bonus years of life to Americans. That's what's changed. Robert F. Kennedy Jr. isn't selling a Make America Healthy Again agenda. It's a Make America Sick Again agenda that Robert F. Kennedy is selling to the American people, and we have to stop it. Ever since he was confirmed, Kennedy has been recklessly gutting life-saving research, slashing community health center funding, spreading misinformation and outright lies about vaccines and science. Sadly, misinformation spreads as fast as COVID, as fast as measles and other diseases. And these diseases know no state boundaries. People in Massachusetts are endangered if people in other states aren't getting their vaccinations. We have a highly mobile nation. And right now, after the largest measles outbreak in 33 years that affected 1,300 Americans, Florida has announced its plan to scrap all vaccination requirements for children. That will be a public health calamity. The price of admission to Disney World shouldn't be a case of measles or COVID for a child from Massachusetts being taken by their parents down to Disney World this winter. We need every community to know that Robert Kennedy Jr. is doing what is endangering our public health, and so we must now defend ourselves. And that's why today I am releasing a tracker that will update regularly all of the dangerous actions Robert F. Kennedy Jr. has taken since he was confirmed as Secretary of Health and Human Services. I am releasing it and putting it up so it will be there for everyone to see where the dangers are that Robert F. Kennedy has created. The RFK Jr. attacks tracker includes firing more than 10,000 employees, including 2,400 staff at the CDC, firing all 17 experts on the CDC's Vaccine Advisory Committee, and replacing them with vaccine skeptics, including some with whom he worked in order to spread for pay that disinformation about vaccines. Updating the FDA authorizations for COVID vaccines in August so children and those under the age of 65 can no longer access COVID vaccines. These recent changes to COVID vaccine authorizations are already causing confusion and uncertainty for patients, providers, and pharmacies alike. We know that pharmacies such as CVS and Walgreens are introducing prescription requirements, if not outright suspending access to new COVID boosters in some states as they navigate a patchwork of conflicting federal, state, and local rules. And that is why today I am also sending a letter to CVS and Walgreens to ask them about their recent policy changes to vaccine access at their pharmacies across our country. We are grateful that Governor Healy has taken the important step to protect us here in Massachusetts by requiring health insurers to cover vaccines recommended by state health officials, regardless of what the CDC recommends. But the American people deserve clarity, accountability, and rapid corrective action to restore vaccine access. They deserve a top health official who believes in science, who can be certain to make decisions to protect the health of every family in our state and across our nation. So none of this is a surprise. At every hearing, And in every decision, RFK Jr. has consistently peddled lies at the expense of public health. And Republicans continue to refuse to hold RFK Jr. accountable in any meaningful way. The Republicans knew he was lying when he told senators during the confirmation hearing in January that he was not anti-vaccine, despite evidence that RFK Jr. for years regularly ignored scientific evidence and spread vaccine misinformation. Yet they voted yes to confirm him. The Republicans knew he lied when RFK Jr. claimed no responsibility for perpetuating anti-vaccine sentiments in Samoa that led to a measles outbreak that killed 83 people. Yet the Republicans voted yes to confirm him. The Republicans knew he lied when RFK Jr. promised that he would do nothing that would make it difficult or discourage people from taking vaccines, despite his efforts in 2021 to petition the FDA to reverse its emergency authorization for COVID vaccines. Yet the Republicans voted to confirm him as the Secretary of Health and Human Services. Republicans would rather protect Trump than the American people. And we are now seeing the all too real consequences of their actions. We know our healthcare system is broken. It's a sick care system controlled by insurance companies and pharmaceutical companies just trying to make a buck at the expense of Americans' health. We need families to have faith that its leaders support a health system that puts patients, not profits, at the center of accessing of care. That's the system we need to have built in our country, not dismantled, but made even stronger to protect the health of the American people. So I call on every one of my Republican colleagues, join me, join my Democratic colleagues, the multitude of medical associations, healthcare providers, 9 former CDC directors, over 1,000 current and former HHS employees, and demand the resignation of Robert F. Kennedy Jr. I demand that Robert F. Kennedy Jr. resign as Secretary of Health and Human Services. He is endangering the lives of every American family with his policies. So let me now stop and introduce a great leader for the public health of our nation, Dr. Rochelle Walensky, the former director of the Centers for Disease Control. Doctor.
Good morning. I want to thank Senator Markey for the honor of being here with you today, for holding this event, and especially here at the Codman Square Health Center, founded on a dream to build the best urban community in America and recognizing that healthcare begins with alleviating sickness. So I want to thank all of you for the work you do here at Codman Square toward that end. When I was appointed the director of the Centers for Disease Control and Prevention in January of 2021, the headline said that I was a political outsider who lacked government experience. They were right. I spent 25 years at the bedside caring for patients, and I never once asked one of them how they voted. And I conducted research that resulted in policy change to increase access to HIV treatments. Maybe my then paucity of government experience was my Achilles heel. I will call it my North Star. The CDC was founded in 1946 and has been chronically underfunded to accomplish the tasks for which it's responsible. By its 74th year, the CDC had never tackled a public health disaster like the COVID-19 pandemic, affecting 340 million Americans all at once. With 4,000 people dying every single day in the United States from COVID-19, I took the directorship of a weary agency. Decision requests reached my desk when there were only bad answers to choose from and sparse data to guide them. I left the agency after my 2.5-year tenure, having assisted the effort of putting nearly 700 million COVID-19 vaccine doses into arms, an effort that has been estimated to have saved 3.2 million lives. There is a clear nexus between the narrative around the perception of CDC's performance and the treacherous place we now find ourselves. The shortcomings of CDC, both real and fictional, during the height of the COVID-19 pandemic are being used as a pretext to dismantle both the agency and the programs that ensure Americans have access to life-saving vaccines. HHS leadership is inching towards a complete vaccine takedown, incrementally chiseling away at our previously trusted systems, leaving behind a shaky, fragmented vaccine facade that is increasingly obscure and untenable and that has already limited vaccine access. Numerous steps have been taken. I will outline them for you. Restricting vaccine access by age and risk factors. I'm so grateful to Governor Healy and Commissioner Goldstein for the actions yesterday so that this is less of a challenge here in the great state of Massachusetts. Withdrawal of $500 million in BARDA funding for mRNA research. Dismissal of 17 expert members of the Advisory Committee on Immunization Practices and replacing them with a panel of vaccine skeptics, and firing CDC Director Susan Monarez for refusing wholesale acceptance of the new panel's recommendations. Sowing doubt and confusion into who should get vaccines. For example, a posting from HHS on X noted that pregnant women would no longer be eligible for a COVID-19 vaccine, when their very own FDA commissioner had just authored a piece in the New England Journal of Medicine, which clearly stated that pregnant women are on the list of underlying medical conditions that, quote, increase a person's risk of severe COVID-19. Instilling fear in those that follow the advice of the American Academy of Pediatrics, who recently recommended vaccination of babies 6 months to 2 years old. Another HHS post incorrectly noted that recommendations that diverge from CDC's official list are not shielded from liability. What's less visible are the plans to reform the Vaccine Injury Compensation Program. This program, created in 1986, is a pillar of vaccine policy that compensates the rare but serious cases of true vaccine injury while protecting vaccine makers and healthcare providers from liability. Without it, manufacturers have stopped producing vaccine, and they very well could again. Equally at risk is our Vaccine for Children's program, created in 1993 to provide under and uninsured children free access to the full pediatric vaccine schedule covering 19 diseases. Credited with preventing 472 million illnesses and saving $2.2 trillion, the Vaccine for Children's program now faces review by the newly formed ACIP, who are tasked to scrutinize that schedule and who have a clear anti-vaccine bias. Since the VFC, the Vaccine for Children's program, supplies vaccines for half of America's children, the stakes could not be higher. While I was at CDC and after my departure, I spoke frequently of our country's frail public health infrastructure and about the state of our preparedness for the next public health threat or the next pandemic. I reminisce about those now quaint days when lack of support for public health was our biggest challenge. Today, I'm most saddened by the lives that will be lost, those preventable deaths because of the erosion of our vaccine infrastructure that had previously been designed to foster truth, transparency, and safety. In today's divided America, there's actually one consensus that remains. 92% of parents still vaccinate their children. Surely we can all agree we don't want our children to die. There's an old saying, vaccines don't save lives, vaccinations do. Unless action is taken, and fast, you may be lured into thinking that our vaccines are here, but vaccinations themselves may no longer be within reach. Thank you.
Next, we're going to hear from Dave Foley, president of SEIU 509. Welcome.
Hi, as Senator Markey said, my name is Dave Foley. I'm the president of SEIU Local 509. We represent almost 30,000 workers in human services and education. And I want to talk to you today about the social impacts of what's happening, about the mental health impacts. My colleagues in the Department of Mental Health will tell you that in terms of suicidality, the most vulnerable population in Massachusetts right now is middle-aged, white, conservative men. And there's a reason for this. For the past decade, the MAGA movement has been using every message that they can to erode faith in every institution that they don't control. They have been trying to break down our faith in these institutions so that they can hold power through fear and through a population that is isolated. It is, we cannot continue in this way, and I just want to say that we all know what's happening here with vaccines, and there are health professionals behind me and doctors and former CDC directors who can say it better than I do, but on a personal level, I have 3 kids. They're in middle school and high school. My youngest is 11 right now, and I never had to worry about them contracting certain childhood diseases. And a future is now opening up before us where I will have to worry about that with my grandkids, contracting measles and mumps and polio. And I want to thank Senator Markey and I want to thank the health professionals who are behind me for trying to close that future and trying to keep this country healthy and safe. Thank you.
Next, we're going to hear from Dr. Mary Beth Miotto, pediatrician at the Mattapan Community Health Center. Welcome, Doctor.
Thank you, Senator Markey, and everybody for bringing health and science advocates here together today. My name is Dr. Mary Beth Miotto. I'm a pediatrician, as you've heard, at the neighbor to Codman Square, the Mattapan Community Health Center. As the immediate past president of the Massachusetts chapter of the American Academy of Pediatrics, I represent our chapter of 1,600 pediatricians and trainees. I also stand up here for the 67,000 pediatrician members of the American Academy of Pediatrics nationwide. I completed my pediatric residency in 1995. The August 2024 CDC report showed that for children born during 1994 to 2023, routine childhood vaccinations will have prevented about 508 million cases of illness, 32 million hospitalizations, and 1,129,000 deaths. Okay, this is deaths of children. We don't talk about nature all the time, but this isn't a nature type thing that we want. Is it natural for children to die? If it's nature, I don't want that. My pediatric colleagues and I have watched immunizations help children build immunity against diseases which I saw regularly as a trainee over 30 years ago. Commitment to child health is not a partisan issue. Prior to 2025, Republican and Democratic administrations supported child health through widespread immunization efforts. So early this year, pediatricians looked forward to working with the Department of Health and Human Services to tackle all threats to youth well-being. Unfortunately, a series of unfortunate events have put American children at risk. These include what you've heard before, the late May changes to child and maternal COVID vaccine recommendations without any new evidence, the abrupt June replacement of well-vetted panelists on the Advisory Committee on Immunization Practices, with many individuals lacking any relevant vaccine or infectious disease expertise. The lack of consultation with CDC scientists not only resulted in ACIP votes based on misinformation-riddled presentations, but also contributed to the recent ouster of the CDC director and the resignation of leaders that are crucial to me as a pediatrician to help us maintain protection from infectious diseases. HHS leaders have disregarded these thoughtful processes to evaluate and, yes, update vaccine recommendations. And because of that, they've manufactured a COVID vaccine access crisis across our country, even for those Americans deemed eligible. Pediatricians are always willing to discuss not only the benefits but the risks of vaccines. As individual clinicians, we'll continue to step up and provide accurate information so families can make their best decisions. The American Academy of Pediatrics has been creating evidence-based vaccine recommendations on their own since its founding in the 1930s. These are rooted in deep clinical knowledge of child health and development and the needs of not only the children, but their families and our communities. We're disappointed that our federal partners are no longer helping us keep these children safe from life-threatening infections, but we are in it for the children. Thank you very much.
Thank you, Doctor, so much. And again, we're just going to keep coming back to this point where it's clear that the lies of Donald Trump and the lies of Robert F. Kennedy Jr. are going to lead to people dying because they will not get the vaccinations which they and their families need. Next, we're going to hear from Dr. Eli Fryman, pediatric emergency medical physician. Welcome.
Thank you, Senator. Good morning. My name is Eli Fryman, and I'm a board-certified pediatric emergency medicine provider practicing in the ER at Newton Wellesley Hospital. I'm also an officer of the Massachusetts Medical Society. I want to thank Senator Markey, his wonderful team, for his incredible leadership in these unprecedented times, and for inviting me here to speak with you all today. In the emergency room, I meet families on their hardest days, when their child is struggling to breathe, fighting a serious infection, or suddenly very ill. After a scary emergency room visit, parents often ask me how to protect their children and what they can do to prevent their child from returning to the ER. It's an everyday conversation for me when I reiterate to parents the importance of vaccines and how they are among the most effective tools we have to prevent serious illness and, yes, death in children. The illnesses we vaccinate against, polio, measles, whooping cough, pneumonia, chickenpox, hepatitis, meningitis, and more, are not just inconvenient. I have personally witnessed many of their disastrous effects in my ER, and I am not exaggerating when I say they can be debilitating and cost children their lives. The impression that a 2-week-old with whooping cough, struggling to breathe in the arms of a terrified parent leaves on you, you never forget. I hope I never have to again admit a severely dehydrated infant to the hospital on an IV drip due to rotavirus diarrhea. One of my mentors still tells stories about performing nightly spinal taps in infants due to H. flu meningitis. These diseases have not disappeared, and this threat is not theoretical. The fact that we see so little of them today is a direct result of vaccination. For families and their children, this is something very real. Vaccination can be the difference between me admitting a school-aged child to an intensive care unit on a ventilator with influenza pneumonia or COVID pneumonia, or that child being at home, happy, in school, playing, and thriving. A parent who might face days in the hospital is instead able to keep working and caring for their family. With all the recent turmoil and misinformation, we know this is a confusing and scary time for parents and families. I always welcome conversations with families who have questions about vaccines. Vaccines, including the COVID-19 vaccine, are some of the safest and most thoroughly tested medical interventions ever developed. They have completely revolutionized pediatric public health, turning once common childhood killers into preventable conditions. The evidence could not be more clear. Vaccines are safe, vaccines are effective, and vaccines save lives. Our responsibility as physicians is to keep patients safe. Vaccines are one of the most important ways that we fulfill that responsibility. I'm so grateful to practice in Massachusetts, where our governor and public health leaders took action this week to safeguard access to evidence-based immunizations and ensure Massachusetts patients continue to receive critical preventative care. In Massachusetts, we will continue to lead with science, to follow the evidence, and to prioritize health and safety for all of our residents. Importantly, today we reaffirm our unwavering support of all who play critical roles in safeguarding public health. Thank you.
Thanks, sir. And we're here at the Codman Square Community Health Center, where they're on the front lines of providing health care for the community. They make it very easy for people to walk in, that the language of their native nation will be spoken here. They trust the physicians and the nurses who are here. So what we're talking about today is absolutely critical, because the Republicans just voted to cut $900 billion from Medicaid, which helps fund this healthcare facility. $300 billion from the Affordable Care Act, which helps to fund this facility. And on top of that, they're now putting a cloud over vaccines, which are absolutely vital to ensuring that this community and their children are made safe. So we're here really at the epicenter of where the risk is going to be run, because of all of these cuts, all of these program changes that the Trump administration, led by Robert F. Kennedy, are trying to put in place. So let me now introduce Sarah Baswell, a registered nurse and member of the Massachusetts Nurse Association's Board of Directors. Welcome.
Good morning, everyone. My name is Sarah Baswell, and I'm a registered nurse and a proud member of the Massachusetts Nurses Association. I want to thank Senator Markey for standing with nurses and healthcare providers as we confront dangerous misinformation and misguided decisions that threaten public health. As caregivers, we see firsthand the consequences of COVID-19, the flu, and other preventable diseases. We are at our patients' bedside when they can't breathe, providing life-saving treatment. We support family members who can't be with their loved ones. We have lived through years of grief, loss, and exhaustion as the pandemic and its fallout have taken a devastating toll. After going through all of that, seeing our federal public health infrastructure taken over by people who are undermining science is infuriating. Robert F. Kennedy Jr. and his HHS loyalists are truly making America sick again. In recent months, we have seen an unprecedented gutting of HHS that has crippled our public health infrastructure. Thousands of dedicated federal health professionals have been laid off or pushed out. The CDC and FDA have borne the brunt of these cuts. The Trump administration is completely abandoning the public health safeguards that protect our communities every day. Secretary Kennedy has also fired all 17 members of the Advisory Committee on Immunization Practices and replaced them with people who lack scientific credentials or hold anti-vaccine views. This has led to a damaging rollback of important vaccine recommendations. COVID-19 vaccines are no longer endorsed federally for all children or pregnant women, and mRNA vaccine development funding has been slashed. Kennedy's attacks on vaccines is especially troubling. Vaccines save lives. They work best when the whole community participates, because the health of one depends on the health of us all. We cannot allow individuals like Kennedy to undermine the trust in vaccines. Spreading doubt and misinformation prolongs disease, keeps hospital beds full, and puts caregivers, patients, and families at risk. It's also important to keep in mind that while vaccines are strong weapons against public health threats, they are not the only one. We must also ensure safe staffing, protect caregivers from workplace violence, and safeguard access to essential healthcare services. In the end, this fight isn't about politics or power. It's about whether our patients live or die. As nurses and healthcare professionals, we will continue to speak the truth, advocate for evidence-based care, and fight for every life entrusted to us. If we work together, we can restore trust and protect science. We will choose truth. We will choose life. Thank you.
Good job. Thank you. Great job. Next, we're going to hear from Dr. Christopher Loker, who is the CEO and co-founder of Versatope Therapeutics. Welcome.
Thank you, Senator Markey. I'm also a principal investigator of an NIH contract. We worked with the NIH for more than 5 years to develop an influenza vaccine that protects against many different diverse strains of flu. This would enable people not to have to come back year after year to get an influenza vaccine. This is what we call a universal influenza A vaccine that could also protect against pandemics and prevent against a biothreat agent that could cross our borders and affect all people. Since we launched the program, we received FDA allowance for our clinical study. We did all the work in Lowell, Massachusetts at a small incubator with... As I was saying, we developed an influenza vaccine that protects against many different strains of influenza. And in doing so, we did all this here in Massachusetts, funded by the National Institutes of Health, where I'm a principal investigator. We received FDA clearance for a phase 1 clinical study. And at the time, we were told by our NIH collaborators to cease work on the program for 89 days during a funding freeze earlier this year, following the inauguration of President Trump. At the 89th day, we received a notice that they were canceling our contract for convenience. This vaccine that we were developing could be a game changer when it comes to influenza immunizations and prevent the next pandemic. One thing that people don't talk about is the economic perils of not immunizing people. For example, with COVID, it's estimated that there were $15 trillion lost to the economy due to the COVID pandemic. Influenza is a biothreat agent that could affect another pandemic and is a true threat to our country. Developing old antiquated vaccine technologies will not help the cause. We need new technologies developed here in Massachusetts. Biotechnology has received a renaissance here in the state, and I hope it'll continue. But many small startup companies are suffering at this time due to the funding cuts at the NIH. And it's also at the university level that's been covered in the press. But unfortunately, I've had to lay off more than half of my team, and we're downsizing the project substantially. We hope we can survive with private money, and we'll have to see how it goes. But my team remains committed and ready to come back to work when the funding is available to pick up the pieces and carry on with our influenza vaccine program. And I appreciate Senator Ed Markey's work for the universal influenza vaccine funding at the National Institutes of Health. And unfortunately, many of my colleagues at the National Institutes of Health are no longer available by phone call or email. They simply just don't respond. And it really is tragic what's happening in our nation, not only at the community level, but also at the basic research level. And thank you.
Thank you, Doctor. And again, he's a perfect example of what is just going off the rails. I fought for years to put in the funding for a universal flu vaccine. About 30,000 people die every year from the flu because scientists can never be quite sure which strain of the flu is going to show up that winter, while they still recommend getting the flu vaccination. Dr. Locher is working on finding a universal flu vaccine that would protect against all of the strains. And now that is being defunded. Again, that's a shot in the arm, if it was available, that every American should have access to. So it's all part of the same story, what's going on. It's not just at HHS, at the CDC, but it's at NIH, it's at the FDA, it's on agency after agency. And finally, we're going to hear from Dr. Hannah Grunwald, who's a postdoctoral fellow at Harvard Medical School. Welcome, Doctor.
Thank you so much. I'm really excited to speak to you today. And before I start, I want to thank the Senator for his incredible advocacy and every single one of these speakers for truly being on the front lines. I'm going to tell you a little bit about the research side. So at the same time as all of these policy changes are just gutting public health initiatives, the government has undertaken this huge project to roll back scientific research, which means that not only are we losing decades of health advances, we are also losing the precious opportunity to find new treatments and cures. Because the truth is that behind every cancer treatment, every gene therapy, every over-the-counter medication, every vaccine, is an academic lab doing that basic science to understand what's going on there. So my name's Hannah Grunwald. I'm a postdoctoral fellow at Boston Children's Hospital and at Harvard Medical School. To give you a sense of what that means, I got my PhD about 5 years ago, and now I work with two incredible mentors, professors, who are helping me shape my own independent research program so I can start my lab. I work on something weird. Are you ready? I work on the evolution of the eyeless cave fish. And the reason I do that is because we actually have really good evidence that it's a clear example of an instance where genetic information was hidden and then triggered to emerge. Now, right now, we know a lot of genetic determinants that might predispose you to a disease, but it's really hard to predict whether it actually will happen. We don't know the difference between someone who has a BRCA1 mutation who will go on to develop breast cancer and someone who won't. And I'm hoping that this sort of research will actually help us predict genetic diseases. So last year, I won a grant to perform this research, but in April of this year, my entire granting program was cut. It was a program that awarded grants for early career researchers like myself. Unfortunately, it was also geared towards folks like me that spend a certain amount of their time in service to the community. I work really hard to make sure that science in America recruits and retains and makes space for a whole diversity of thought and background, make sure that our scientists are excellent and they're supported. This was a grant program that really would have lifted up brilliant scholars, people so much smarter than me, people who study everything from development to diabetes, autoimmune disorders, dementia. We were the early casualties. I'm gonna wait. We were some of the early casualties of this purge of science, but we're not the only ones, right? I mean, at this point, they've been completely scrapping enormous programs that train scientists to do science. They've taken away grants on avian flu, HIV, breast cancer outcomes. When you're exploring the unknown, you come up against a lot of dead ends. And as a result, big companies won't fund basic research. There just isn't the opportunity to know that it's going to pay off. So these big companies play a huge part in making sure that Americans receive safe and effective treatments, but they're never going to pay for those new discoveries. That's what the government is for. After stringent review by experts, the NIH and NSF grant money to scientists to do the really hard work of pushing back the boundaries of human knowledge. And when we lose that funding, there's not a lot to fill in the gaps. When you lose funding, the best case scenario is that you lose months and months of critical research time trying to scramble to replace that funding from some other source. But the worst case scenario is that the project dies. The truth is that in academic science, there's usually one person, one researcher, who's studying a particular question and has a particular angle on it and a particular idea about how to solve it. You take away that grant money, all of their prior research will never be published. It's lost. All of the future breakthroughs that would have been happened are gone. An NIH grant is the difference between a research project that dwindles away into nothing and one that produces a critical insight that transforms our understanding of the world. The way I see it, medical breakthroughs are miracles of human ingenuity. They're testaments to what people can achieve through creativity and hard work. They bring us safe and effective treatments and preventative measures that make us all healthier. We should be celebrating them. We should be encouraging them. America used to be the center for scientific thought that the whole world looked to, and I don't want to lose that. Thank you.
Thank you, Dawn. Thank you. And Dr. Grunwald is a very important voice here because she is representing all of the other postdoc fellows all across Boston, all across Massachusetts, who now all have a funding cloud over their heads. They don't know if they're going to have a job next year. They don't know if they're going to be able to continue their research projects. They're getting calls from London, from Montreal, from countries all around the world saying, we'll fund your project in another country. We're the center for medical research in the world. And what their goals are, because it's not to get rich, it's to advance the public health agenda for our country. And Dr. Grunwald is a perfect example of the kinds of young men and women who have entered this field and right now don't know if they will have a job next year if all the funding cuts go through that endanger all of that medical research. So we thank We thank all of this great team of people. And now I'll stop and say, are there any questions? Yeah, Dr. Walensky, come on up.
Very much so. I think that could easily happen. And what I would say is we have so many people who live on the borders between states. So how are we going to have this patchwork allow you to get care in one state when you've gotten your vaccines or not in another state? I think that is not a tenable policy for this country to have 50 different vaccine policies across the country.
Senator, the likelihood that Trump Kennedy's going to resign is slim to none. If he stays in office, what happens? Every American's health is going to be endangered if Robert F. Kennedy Jr. stays in office, if the policies he's advancing stay in place. These are policies that will make America sick again. It will take us back in terms of life expectancy for our country, but it will endanger children, seniors, anyone with a vulnerable condition. And so yesterday there were some Republicans that started to raise some questions about Kennedy's policies, but will it actually turn into a vote on the floor of the Senate after a call from Donald Trump? Well, thus far, that has not been anything that we've seen. So that's why the pressure has to be created from the grassroots through these Republican senators to let them know that that people are very concerned about their families' health, of their children's health, of their seniors' health in their families. Okay, this is all going to be political action. Congress is a stimulus response institution, and there's nothing more stimulating than millions of Americans raising their voices about the health of their children, the health of their families. And I think that pressure is really starting to build, and we could start to see the beginnings of doubt in some of those senators' questions yesterday on the Senate floor.
Backing up with that, if
Yeah.
Secretary Kennedy does not resign, and if the Republicans do not say if they were going to stand up and do something, what do the people in Massachusetts do? I mean, what elected leaders that represent us do to make us feel like we're safe?
Governor Healy is leading. She is putting in place a policy to protect the citizens of Massachusetts. But we live in a country where Florida, and soon to be followed, I'm sure, other red states will be blocking policies that ensure the vaccination of all of the children, all of the adults in our country. And that's going to endanger us in the same way that the COVID virus actually had its first big incident right here in Boston at the Biogen conference. Those people all got back on planes and flew across the country and flew across the world. That's what's going to happen. We'll try to protect ourselves, and Governor Healy's going to do a great job. But there's a limit if the rest of the country is not vaccinated, does not have public health protections as well. I'd like, Dr. Walensky, maybe you can, I'm sorry.
As people are starting to hear this information, they're confused about it, because we're hearing both sides. What do you do as a parent going in about getting your kids vaccinated?
First, I want to comment that there are incredible heroes that are working at CDC, and it pains me to have people say the CDC can no longer be trusted, because those heroes are still there and they're doing their best. What I can say is the vaccine information on the CDC is not necessarily that of the subject matter experts of the CDC, but there's a lot of other great information on the CDC website that I don't believe has been tainted with as of yet. What I will also say is that our medical societies, AAP, ACOG, Infectious Disease Society of America, AMA, are putting out information. All of that used to be consistent with the CDC's websites. Now it's no longer. And the thing that has changed is not the societies. It's what's being posted on the CDC by our vaccine skeptics. So I would encourage you to go to your hospitals for information, to go to your healthcare providers for information, and to go to your societies.
Question. Anybody else have a question? And I would just I would like to say that on another subject, but it's directly related to the ongoing attacks by Donald Trump on Boston and Massachusetts and what we stand for, whether it be healthcare or law enforcement. that Donald Trump's lawsuit against the city of Boston, in terms of ICE, in terms of the city's statute that does provide protections, Mayor Wu is doing a great job in protecting the city. We have the lowest crime rate in the United States of America. ICE and Trump could get lessons from Michelle Wu and the Boston Police Department as to how to best police. So we have to stand up against this authoritarianism that is coming out of the Trump administration, and that lawsuit yesterday must be fought because Boston knows how to keep its people safe. So,
what is Congress doing
around which subject now?
around the suit?
On the suit?
Is there anything Congress can do?
Again, Mayor Wu is our leader, and she knows how to make the city safe. And so this must be fought because it is an illegal intervention into the local policing responsibilities of our community. It is a violation of the 10th Amendment. It is a violation of the Posse Comitatus law of the 1870s. It is up to the local communities to police. It is up to those communities to determine how to make their cities safe. And in our city, the Boston Police and Mayor Wu have made it the safest city in our country. We don't need Donald Trump. We don't need his ICE policies coming to our city.
Do you think that the Trump administration is picking on Boston because they're specifically going after the Trump now? That's something that's specific to this area.
Yeah. Trump is targeting cities across our country that are majority minority communities. Los Angeles, Chicago, New York, Boston. That is their plan. It is to try to turn this into an issue where he is scaring white suburban voters across the country about black and brown citizens in our nation, even when you talk about a city like Boston that has the lowest crime rate in the nation, notwithstanding the fact that it's a majority black and brown community. So that's what he's trying to do. It's all part of that MAGA playbook to make America great again by making America hate again. And we are not going to stand for it here in Massachusetts or in Boston. So thank you all so much. Thanks for being here. Thank you.